At 8 o'clock, we're calling to order the Board of Inspectors meeting for Center County. And at this time, we will accept any public comments for items that do not appear on our agenda. Is there any public comment at this time? Okay, seeing no public comment, we will accept public comment as each item is under consideration. We have the August Board of Inspectors meeting minutes to approve. Is there a motion to approve those minutes?
Motion to approve the minutes.
Seconded.
It's been moved by Controller Moser, seconded by Sheriff Samsel. Any further discussion on the minutes? Hearing none, all in favor of approving the minutes do so by saying aye. Aye.
Aye.
Aye.
Aye.
Opposed, say nay. The motion is carried. Okay. Good morning, everybody, once again, and we'll turn it over to Warden Shell and his team. Good morning, Chris.
Good morning, everyone. Just starting off with our returning citizens report. Center County Mental Health, Amy Miller. A year ago, she's seen 23. This past August, she's seen 17. She referred 3 to PSU Psych, 8 to Crossroads Mental Health Group. Dr. Wolf, they're still virtual. They've seen 12 returning citizens the month of August. Crossroads is still virtual. The drug and alcohol, they see 7 male returning citizens 4 times per month, 2 female returning citizens 4 times per month. The mental health group, they see 6 male returning citizens 4 times per month, and they have 2 female returning citizens 4 times a month. Going into our Center County Compass program, the male group has currently 9 returning citizens in there. They have 4 peer supports. They meet 4 times per week for the last 4 weeks. The female group has 6 returning citizens, 5 peer supports in that group, and 4 times per week for 4 weeks. The graduation of August was 3 females and 3 males. Work release, community reentry workers, centerpiece is 2, county maintenance is 2, grounds is 2, and work release currently is 0, and a year ago was 0. Our prison monthly report here with our Center County population is a snapshot of August 31, 2021, not July. Our total count was 199. 132 was Center County population out of 192. 18 females, 114 males. Unsentenced was 92. 13 females, 79 males. County sentence was 32. 5 females, 27 males, and state sentence was 8 males. Tenement County, a total of 67, 22 females, 45 males. Unsentenced is 27, 16 females, 11 males. County sentence was 39, 6 females, 33 males, and state sentence was 1, that was 1 male. Our August daily populations from the first, we were around 133, 71 Tenement County, and by the end of the month we were down to 70 of Tenement County and 131 with Center County, so we kind of stayed pretty neutral there. Our prison monthly report here with our Center County unsentenced population, snapshot of August 31st, 2021. New charges, individuals that are in here on new charges only are 42 males. Probation and parole only is 17 males, 9 females with a total of 26. Probation parole with new charges is 19 males, 5 females, and a total of 24. Comes out to a total of 92 unsentenced out of our 199 population. Continuing on our modification, behavior modification status, Tier 0 we have 4, Tier 1 we have 3, and then we have 18 out in general population at this time. Co-occurring disorder, mental illness, and drug addictions. A year ago, we had 23 with an intake of 81. This past August, we had 16 out of 84, was 19% of our intakes. Only 10 were on or have not refilled medications upon intake. Out of the 16, 10 was from Center County, 6 females, 4 males, 6 was from out of county, 1 female, and 5 males. Suicide watch, a year ago we had 17, past August we had 14, 11 from center, 1 female, 10 males, 3 from out of county, 3 females, 0 males. Out of the 14, we had 4 detoxing, 3 is from center, 1 female, 2 males, 1 from out of county, 1 female. Detox total a year ago was 24, 14 from center and 10 from out of county. This past August is a total of 24, 9 females, 15 males. Out of the 24, 20 was from center, 6 females, 14 males, 4 from out of county, 3 females, 1 male. There we go. Substance detox by the numbers. Heroin, we have a total of 10, 9 from center, 2 from other. We had 0 on benzo. We had 1 on meth from center. We had 3 for alcohol, was from center. Suboxone, we had 1 from center and 1 from out of county, total of 2. And multiple was 7, 3 heroin benzo, 2 center, 1 from out of county. 1 heroin alcohol from center. 1 heroin meth from center. 1 benzo Suboxone from center, 1 heroin, benzo, and alcohol from center. Our FIMAT, we had 1 individual received an injection yesterday, so we're back on course with lining people up. We have another one that's in the pipeline of getting a Vivitrol injection. Hopefully that'll be end of this month or beginning of October. We had 0 at the hospital. Inpatient hospital at this time. Our COVID test results, the symptomatic testing has not changed. Negative was 234, recovery was 75. Asymptomatic testing, total of negative 519, recovered was 50. Total seen by a physician, our PA was a year ago 89, past August 87. Total medical transports to outside physicians a year ago was 12, this past August was 13. Mental health clinician individuals seen a year ago was 128. This past August was 168. Psychiatric, a year ago was 77. This past year was August was 95. Mental health patients on psychotropic medications, returning citizens that were on a psychotropic medication for the entire month of should be August. August a year ago was 99. 62.3% of the ADP was 159. August this year, our ADP was 198, was 118, as a total of 59.6% of our ADP. Our daily average patients diagnosed with mental health, a total of 143 out of 98. This year, a year ago, we had 101 that were category C, which was 62.5%. Category D was 16, which was 10.1% of our population. This past August, we had 118 of category C, which is 59.6% of our population. Category D was 25, with 12.6% of our population. Our mental health stability rating for the entire population, snapshot of August 31 of 2021. We're starting with stability code A is 23, 11% of our population. Stability code B is 18 with 9% of our population. Stability code C is 29 with 65% of our population. Stability code D is 29 with 15% of our population. We have 0 on waiting placement with a total of 199. Mental health stability rating by county. The blue is center county, the orange is out of county, 10 of county inmates. Starting with stability code A, center county had 20, 18 males, 2 females. Out of county was 3 males. Stability code B, center county was 13 males. Stability code B in out of county was 5 males. Stability code C, the total of 81, 67 males, 14 females. Out of county was 48, 20 females, 28 males. Stability code D, center county was a total of 18, 16 males, 2 females. And out of county was a total of 11, 9 males, 2 females. Our inmate grievance report. A year ago, we had 5 grievances. This past August, we had 15. 0 were non-grievable, 5 were grievable, and 10 that we refused for not cooperating through our policies. Central Booking Center. A year ago, they were booking 231. This past August was 201, so we're down by 30. 11 to 7 shift process 34, 7 to 3 process 23, 3 to 11 process 84.
Okay, thank you, Warden. Any questions or feedback, comments from members of the prison board at this time? Okay, hearing none. I did have one question, Chris. The detoxing slide, if you wouldn't mind going back to that, please.
This
Or-
one?
Yes, sir. For the heroin one, that is the highest category that I think in years. Is there any context you can put on that in terms of that number? And I could be wrong on that, but looking back on previous presentations, it looks like that's one of the highest.
That has hit. I know we had a lot more than that in previous years, but however, in the last probably year since the pandemic, this is the highest that we've had. I don't know if we have a reason why. It's just maybe the individuals that diverting off and wanting something more than maybe meth or alcohol or Suboxone. So we don't have an answer. Medical's sitting here with me. They don't really have an answer either. So I mean, it's just it's not a good sign. Let's put it that way.
Okay, and that's a great answer in terms of if we don't know, we don't know. But in terms of the level of services that you're providing, you're good with that in terms of being able to care for them, and you're good. Okay.
Yes, we are fine with that. Like I said, I'm thankful that the Vivitrol shots are back on course, that we can get individuals signed up for that. So that's a good way to divert these individuals when they come in here for another treatment program there, and then plus with our Compass, and then more decision points is coming on at the end of this month with training. So I think we have a really good core of programs that we offer for the individuals inside this correctional facility.
Okay, excellent, absolutely. Okay, all right. Any members of the public have any questions on this agenda item, which is again the monthly reports from our warden?
I do, Michael.
Okay, Connie, please.
I had two questions. One, I noticed there are no people out on work release. Is that because they're not eligible, or you're not letting them go out of the jail for that?
Currently, we have some people in the pipeline. They have to have their the vaccine, COVID-19 vaccine. So we're getting people vaccinated. We have a clinic every month that we hold. So individuals get to sign up for it, and then we get them out on work release right now. So right now, we're just getting people in. I know we're down with Centerpiece right now. Our numbers are down a little bit there. We have a couple I talked to with not having our reentry specialist that we're doing interviews now currently for that. We have the other counselors trying to fill in. So they're trying to do their job as well as trying to pick up the pieces there with reentry. So we have a couple people. I did talk to Danielle Monarchek, which is taking on the part of outside clearance, and she has a couple in the pipeline that we're trying to get ready, get out there to work.
And then my other question might be to Judge Oliver. I noticed there hasn't been much change in the sentencings. Is that because the courts are having difficulty scheduling things? Maybe she had to leave.
And Connie, we can always follow up with you on that in terms of essentially your point and your comment is getting an update on that numbers in terms of where that stands, right?
I'm just concerned that they're sitting there and not getting to court. That's my concern.
I can relay a little bit on this. Those numbers might not change a lot, but you have to also look at our intake that we're getting in. We had 81 intakes come in, so that number is not consistent that these are the same individuals last month that are still sitting here. Okay, it's just the numbers. Yeah, so it's just not the numbers that we could show you numbers each month and it could be 25, but it's not the same individuals 25 because we constantly get intakes in and we got people releasing. So I mean, we're releasing. There's some days we released 8-9 people a day. But then also we might get 4 or 5 in the day. So that number is going to probably equal out at the end of the day. So when, like I said, when you see those numbers, it's not the same individuals that are there maybe last month or 2 months ago. It's just a new people in. Because if you look at our intakes, as I mentioned, we had 81 this past month. I forget what last month was, 90 something. So if you continue to see that 90 or 80 people, that reflects back on that number as well.
Well, that's very helpful.
Okay.
Thank you, Warden. Thank you for that.
I had a question, Commissioner.
Sure, please, Brian.
Hi, this is Brian. I mentioned before I work with Nancy Spooner, the volunteer women's chaplain. I'm also working with Kathy as one of the one of the community conferencing people, which I hope to get more involved in as that moves forward. Warden Shell, I had a question. Can you go to the virus testing slide?
Right there?
Yes, thank you. So am I to take this to mean Delta variant has not come in to the jail? There's still negatives. There's no positives. Is that that sounds like a good thing?
Let's not jinx what we have going on currently. Last time we brought that up, and next thing you know, we had a hiccup. We knock on wood, keep our fingers crossed, and keep our heads low to the ground in the sense of just keep doing what we're doing, practicing good cleanliness, masking everyone, and so forth. At this time, we have not have any positive cases. Like I said, knock on wood on that. So yes, currently right now we are holding at 0.
I mean, that is a huge positive. That is a huge positive. I personally had put my mask away, right, until about 3 weeks ago. I thought it's time to get it back out. And every day in the newspaper, there's more. So I was really hoping that things had not come back into the facility. So that's super positive.
No, we haven't left our mask at all, so we kept them on the entire time since March of 2020, and there's 4 months straight that we wore N95 masks in here. So I got to give kudos to my staff, my admin staff, and everybody else that's been really on top of this with our returning citizens wearing their masks, or lieutenants forcing staff wearing masks, which we really don't have a problem anymore with that. So I'm really pleased about that, because this is the new norm inside corrections, at least Center County. So so we're used to doing what we have to do with wearing masks and so forth. So
yeah, I think kudos to you all for staying so consistent.
Thank you.
I had one other question on the staffing. I know you mentioned this, other folks filling in for the reentry coordinator. I know a couple of months ago we talked about hiring. I'm just curious, how are things going with hiring, bringing more staff? Do you feel like that's gotten any better as far as you all having to fill in less? I'm just curious.
Yes, we as admin staff hadn't had to fill in for the last 3 weeks roughly. The shift's been picked up. We have hired a lot. We have a couple people that's on part-time status currently. We have a couple interviews coming up. Not many, but that's a plus. We're fully staffed with full-time, and we're starting to fill in with our part-time staff. So that's a plus.
That is really awesome. The other thing I just want to mention, I pray for you all at the facility regularly, you all in leadership, the staff. It's a difficult situation, and in particular, I was concerned about the stress and the staffing. So I just want to mention that as well, and thank you for giving that update.
Thank you.
That's very meaningful, Brian. Thank you for that. Thank you. Okay. Any other members of the public that would like to make any comments on that portion of our agenda? Okay. All right. Seeing none, we will then go on to old business, and that is a review and update in terms of, again, COVID-19 and the operations.
There we go. We're going to start off with our coronavirus emergency supplement relief grant. Ooh. Hold on. Okay. Stay there. We received this grant. Carrie helped out with this. She was a tremendous help with this COVID emergency supplement relief grant. So we applied for it. We first looked at getting dumpsters because of our garbage, or basically our flip trays. However, that wasn't feasible because when our contract came up for the trash disposable and everything else, they actually came in lower than actually getting a bin. So we changed course, and we went to this carousel of keeping people's clothes. The officers like it. As you can tell, there's controllers there, which is blue and red. They can actually punch in a number of the bag. If it's 200, they punch in the bag. The bag it'll carousel around to right there where the officer steps up on the rack, and they're able to pull it off. On the left-hand side of your picture, if you see that, it looks like a plastic bag. What that is a sealing bag. So after the individual's clothes are washed, they put them in a bag and they seal it. So it condensed our storage. Instead of throwing things in a small bin, and if they didn't fit in the bin, then they put them in other garbage bags and threw them up on top of the racks. And sometimes things fell out, some things got lost. Now what we do is we basically, once we're done washing it, we stick it in the bag, we seal it. It seals tight like a vacuum seal, and then we're able to slide it into the bags and hang them up there. This way is a lot cleansier. We were able to clean bags better than the bins. We can spray the bags down. We can clean underneath it. The officers aren't trying to roll large walls of bins back and forth. It all runs electrical. The officers are really pleased with it. They like it. George Murphy just compliments it all the time, says how easy it is just to push a number in there and the bag comes right to them. He pulls it off, pulls the stuff out, put it back on. They don't have to take the whole bag out. They just take the clothes out, put the bag back up, take the clothes out. They cut it open, let the inmate have the clothes so that nobody loses anything. So it's a really great thing that we received that grant for this item there. We'll continue on with our programming. Nothing has changed there. Everything's virtual meetings currently right now, as the list has not changed. Programming phone calls have not changed. In person is Compass, Center County Mental Health. Probation assessments are still there. Visiting through non-contact rooms has not changed. Video, same. As I said, we just had a meeting with Kathy Brown about leadership program. We're actually going to hold off until January. Center County leadership of Center County really wants to do this program in person, and I just said we're not there yet. Be able to allow people to come in for in person right now. So I said let's look at January. We already have the curriculum set. This curriculum's not going to change. We're just going to have to wait for a better time for us to be able to allow people to come in for in person at this time. We're doing the Inside Out program with PSU. That's all going to be virtual. We have not heard update on that as well, but I know that's supposed to be starting here sometime in September with Penn State. Our COVID-19 vaccines, September 22nd is our next Goldsberg Apothecary. Returning citizens was 9 received on their first injections. The 6 vaccines is going to be September 30th or October 7th. Our Johnson & Johnson, 8 returning citizens received those. So we don't have the higher numbers that we did receive, but at least we're having consistency of receiving individuals wanting to receive vaccinations. That's it.
Okay, thank you, Chris. Any questions from or feedback from members of the prison board on the old business item of COVID-19? Okay, we'll open it up to any public comment at this time. And Connie, we see you would like to make a comment.
Sorry, but the clothing container, does it only hold one set of clothing, and is that all people have when they come in?
As soon as
Did you get the question, Chris? I don't know if it came
I'm just trying to get to that. I don't know why.
Sure.
Whatever they come in with at that point is when they are arrested by police, probation, troopers, whatever they come in with is what they have. So like we have 2 different size bags. So we have a smaller bag if they only have like a pair of pants and a shirt and sneakers, they can fit in smaller bags. If they have more, that we have larger bags to stick there, like especially when winter's coming around, we're able to put in their coats and everything else, and it'll condense it down into a smaller bag to be able to put in there. So we could fit actually a lot of things in there. We actually were back there. We stuffed it pretty full to where it was very difficult closing the vacuum sealer, and it actually closed and vacuumed and sealed it up nice and tight, and then be able to fit in the bags. But usually individuals, unless they're homeless, that they have their whole life with them at that point. Otherwise, individuals just come in with whatever clothes they have because they were usually picked up on the street at that point.
Well, I just ran into a I just ran into a situation where certificates for my parenting group were put in with their personal property, and I didn't understand that that's all their personal property in that bag.
Well, I'm not saying they might have personal properties at their residence too. This is all they're coming in here, but their personal property, their valuables are separated, and they're also vacuum sealed on a piece of cardboard. But this is what they have with them when they arrived at the institution.
Okay.
Doesn't mean that that's everything they have. They may have a whole wardrobe at home.
No. I'm just talking about other stuff. Do they have any other stuff that they're storing there?
Sometimes they have books. We store their books. As long as they're allowed to have 5 books, and they, 2 of them on their persons and 3 of them in their storage. So there's a big packet. I don't know if you can see there in this, at 118, there's a picture of an individual. There's a big pocket in the front there that, like, we can put certificates, we can put any kind of
Okay.
paperwork, and it's not inside where it's going to get damaged. So it'll slide
Okay.
in the front of there.
So that all of their personal belongings are in this storage area.
Correct.
Okay, thanks.
Yep.
Okay, and Brian, please.
Warden Shell, can you go to the slide of the programming that was showing the PSU and the Access Church Service?
Yes.
Okay, I had a question about the Access Church Service with the videos. Can you tell me how that works? I know Nancy and I are a little bit familiar, but is it that the inmate has to request the video to then be rolled into the block, or do they go into a room, whoever wants to, and then it's kind of shown at a certain time? Can you just tell me how it actually works?
Yeah. So
Logistically.
we received the video Monday or Tuesday. I'm not sure which day we get it. Some days Monday, some days Tuesday. We'll get it from the Access Church Service. Director Height will take it. We have a cart with a TV on there with a DVD player, and he'll roll it in and say, does anybody want to watch, make a big announcement, wake everybody up. Does anybody want to watch church service? And then if they do, they turn the TV off and run the church service at that time. They do that to every housing unit.
Okay, so it's brought into the block Sunday or that day, whatever day it is, brought in and said, who wants to watch it, or do you all want to watch it? And then it's in place of TV for that hour, or what have you.
Yes, correct.
Okay.
It's in there the entire time until the service is over.
Okay, that's great. Thank you. I was just curious.
Thank you, Brian. Please, Judge.
Thank you. Connie, I'm very sorry that I'm not sure what I did there when you asked a question, but I was not trying to run from it. I have difficulty with BlueJeans for some reason, but I'm glad I managed to get it back. I don't know if that question was addressed. I think you had asked about the unsentenced population and whether court access might explain some of that. I will say that certainly over the course of the pandemic, it's been more challenging, obviously, to have things like jury trials, but we are actually conducting trials. We have many scheduled for this, this calendar period right now. So that's been good. I feel like in general, we have been more open, I will say, as we've seen some improvements with respect to the pandemic. Obviously, we're all in a tough spot right now. We are trying as best as we can to keep things from getting too clogged up. And I know everybody that works with the system is working hard to make sure that can happen. So I'm not so sure at this point that is something that's accounting for those numbers. It could be that we're still kind of, clearing out a little bit of backlog. I will say that without having the opportunity to sit down and look at hard numbers, I think that historically, even pre-pandemic, we probably often float at around 40 to 50% unsentenced at any given time. Warden Shell probably keeps a closer eye on that number, but at judicial conferences and kind of statewide, people are looking at those numbers, and that's my recollection, even pre-pandemic. Everybody's trying to make sure that we're moving cases and that, that's not indicative of a problem. So good question. I hope that provides some information for you. And I hope it's not conflicting with anything someone else might
No.
have said. I mean,
Judge,
No, no, that's helpful. The
Good.
only thing I guess I'm concerned about is everybody who is unsentenced really, is it really necessary for them to be in the jail?
Yeah, excellent concern. I can tell you that, you've got a lot of eyes on that at all times. So I'm glad you keep raising it. It's an important question and something for all of us to be constantly paying attention to.
Thanks very much.
yeah, Judge, we discussed that basically. We had 81 intakes, and that has an influx with our numbers there for unsentenced. And the reason is because we have 6 or 7 going out in a day that were sentenced and released, and however we have 6 or 7 coming back in. So the number is basically revolving. It's staying the same, but it's revolving because we do have our intakes that were released. I mean, we publish that every day. What our releases are. So I think, it kind of equals out. It's not the same people, and I think Connie understands that now, that it's not the same people that's been sitting here last month or 2 months ago or 3 months ago. It's a revolving number, but it's staying the same just because of our intakes as well as our releases.
Great, excellent point. Thank you.
Okay, thank you again for just addressing that, Judge. Appreciate that. All right, so we are going to then move on into our monthly reports, and we'll turn it over to Carrie.
Just a quick update. 7 total drug overdose deaths in Center County, 6 accidental, 1 suicide by drug overdose. Last information I have from the coroner's office. And then we did have our candlelight vigil on August 31st in front of the courthouse. And we continue to try to celebrate National Recovery Month this month and celebrate those that have entered into recovery from substance use disorder. So that's all I have.
Okay, thank you, Carrie. For Prison Society, Janet had sent an email over saying that she couldn't make it, but we didn't know if there was anybody else from Prison Society that wanted to make an update or any comments.
I'd like to just report briefly on the Parenting Inside Out program, and a full report will be coming, but we had 8 people start the program. 1 woman left after the first week because she was released, and we always cheer that. Of the 7 remaining, 2 had to be dismissed from the program because of behavioral issues, and the 5 remaining women completed the program. All but 1 had perfect attendance. So I would say it was a successful session.
Great, thank you very much, Connie. And then Centerpiece, we'll turn it over to Kathy.
Yeah, I mean, the warden had reported on leadership reentry and that we're going to hold off until January. So we're disappointed, but certainly understand the safety measures, and we do feel it's important to do that in person. So we'll gladly wait for that. I just found out yesterday we are going to be able to do the fall entrepreneurial course. I think we're looking at like a 10/9 start, but I need to confirm everything with Director Height on that. And I think that's it for now. We appreciate the guys you're sending over. We certainly understand the difficulties, and we'll take anyone you've got. So thank you.
Okay, thank you so much, Kathy. All right, that concludes our monthly reports. We'll see if there's any other business to come before the prison board that anybody would like to raise as board members. Any other discussion items? Okay. Okay, we're hearing none. We'd look at this time at 8:34 for a motion to adjourn the meeting.
Motion to adjourn at 8:34.
Second.
Okay, we had a motion from Commissioner Higgins to adjourn, seconded by Sheriff Samsel. Any further discussion on adjournment? Hearing none, all those in favor of adjourning do so by saying aye. Aye.
Aye.
The motion is carried. Thank you all. Have a great day.
Thank you, everyone. Have a good day.